Hi friends, I am Dr. Anand Kumar, surgical gastroenterologist from Ananya Gastroenterology. Let us know about what happens if gallbladder stones are not treated. What can be the problems which are faced by the people who have gallbladder stones? See, this is the liver and this is the gallbladder. It is situated in such a way that anything goes wrong with it is going to be detrimental to life. The complications, we always call them as gallbladder local complications. When they slip down into the bile duct, the complications, when it slipped out and goes out, and this is the organ called pancreas, the pancreatitis. The first and foremost thing is people usually have is severe pain in the right hypochondrium or right upper abdomen. Then they say my pain is gone back and it is severe, I am vomiting, I am not able to sit or stand. So they come to the doctor. What happens is the stone slips down and blocks the neck of the gallbladder. We call it as a blocked gallbladder neck, where the content in the gallbladder gets infected and it forms pus. We call in medical terms as empyema. And once there is a pus inside, the blood supply to the gallbladder goes and it forms what is called necrotic gallbladder or gangrenous gallbladder. So it ruptures. Once it ruptures, the bile itself is called a poison. We call it as, it is very toxic to the human body when it comes out of the gallbladder into the abdominal cavity, and people end up with what is called septicemia. And we need to rush the patient from casual to the theatre, operate quickly, take out the gallbladder, clean the abdomen, everything, whatever the pus is there. Patient goes through a open surgery with so much difficulty, he has to come out and we need to struggle to save him. The other complications are, if there are small gallbladder stones, they sometimes cause pain, they sometimes cause dyspepsia. Suddenly they slip down into the bile duct which connects to the intestine from liver, and it causes, suddenly somebody observes sudden pain and pain decreases. Patient suddenly seen in the house, people say, oh, you have jaundice, let us go to the doctor, they will investigate you thoroughly, and then the diagnosis will be there is a stone in the bile duct. Then again what happens is we need to go and do a different procedure called ERCP to take out the stone in the duct, put a stent. Stent has its own complications. It causes cholangitis, it can cause pancreatitis. So what you call a healthy system is getting infected. So complications are these two initial complications. The other complications which is life-threatening is pancreatitis. When the small stones comes down into the duct and goes off, suddenly there will be a open pressure, high pressure, the bile refluxes into the pancreas and causes pancreatitis, which is very life-threatening. People can go on to ventilator, stay on ventilator for days together, and we may have to operate on him to save him. In some patient we have to do emergency ERCP to remove the stone which is partially stuck in the duct and try to save him. So basically people end up with more complications if they don't get operated early. So complications of gallbladder stones are, one is gallbladder undergoing gangrenous changes itself, then duct going stone going into the duct causing obstruction, causing obstructive jaundice, then the stone gets dislodged and gets pancreatitis. These are all dreaded complications. And if you leave the stone, so all these have not happened. If you leave the stone for years together, it grows in size, it can cause cancer of the gallbladder also. So what is the use of keeping stones in the gallbladder if they are not causing you trouble? They can never keep quiet. So remember, they can never keep quiet. They can keep troubling you, or they can trouble you at a later stage. So always I advise, once you have gallbladder stones, go to your surgeon, not to the physician or medical gastroenterologist. Get a perfect opinion and get rid of your gallbladder with the gallstones, and you have a safe life. So this is my advice. Thank you.